Thank you, sir.
Good afternoon. I am Dr. Ward, Gregory Ward. I'm currently a practicing physician in Baton Rouge, Louisiana. My specialty is physical medicine rehabilitation. My undergraduate degree is from Wesleyan University, Middletown, Connecticut. Attended Medical College of Ohio. Pursued a residency training program at Rush University in Chicago, Illinois, and spent a year at Mayo Clinic before pursuing a PhD program at University of Chicago. I am currently the Director of Spinal Cord Injury, Head Injury at the Rehabilitation Hospital, Baton Rouge, Medical Director at Lane Rehabilitation Center, and currently Medical Director at Accord Rehab and a small community rural rehabilitation center. My trek with respect to medical cannabis began perhaps 2 years ago. I currently am licensed in Florida, currently licensed in Louisiana, and was asked to join a group of physicians in Florida. I've been practicing medical cannabis for the last 2 years and have a patient base of roughly 1,400 to 2,000 patients as well. And as a result, the science behind medical cannabis is significantly exciting. Cannabis, by way of introduction, began in China many centuries ago, and then, of course, the trek began from there to India as a herbal formation. Cannabis, by and large, not to regress from the current scope, but nonetheless to give some background in the scope of how the medicine or the science behind it is important, began as it's a extremely interesting plant, by way of the fact that there are 400 different cannabinoids in the plant itself, and extraction principles have yet to elucidate the entire scope of how this medicine continues to work. With respect to the current inhalable status or the aerosol status, it's a clean form of delivery. And in fact, the studies began with the pharmacy and toxicology studies that began with aerosolization of tobacco versus the vape systems, et cetera, or the aerosol vape systems again, such as a cleaner delivery, quicker delivery. So with respect to the medicinal component of it, you think of aerosolization of cannabis as a short-acting medication, while the edibles and some of the oral agents are more long-acting, because there's a biochemical component that takes place in the system, delivery system, that creates a longer acting component when it's edible. So in other words, the active component of the cannabis plant, there are two components, CBD and THC. The THC component is a hypnotic, it's also psychoactive, and with respect to the CBD component, that is the anti-inflammatory based component of the plant itself. Without the two, you have to have both clinically, because one helps to limit side effects that might be associated with the THC, which might include irritability, excitability, etc. But it's also, from the THC standpoint, from that perspective, is the psychoactive component, which allows patients with PTSD and other generalized anxiety components to offset some of those effects that exist with those patients. Now, having said that, clinically, with respect to PTSD, there are two receptor sites in the brain, notoriously in the amygdala. The amygdala component of the brain it's the area where we think it's called part of the limbic system, whereby our emotions, fears, anxieties take place. The amygdalae, meaning that there are two aspects of it, which are one on each side of the brain, have receptor sites for the CBD type 1, the two receptors of CBD type 1 and type 2, of which and by which the THC molecule attaches to the CBD in conjunction. It's like a cofactor, but it impacts in such a way that it gives rise to a clinical outcome that's favorable. With respect to that, in its scope of concern, I believe that generalized anxiety disorder needs to be a part of the clinical conditions that qualify for patients who receive medical cannabis from that regard. So without much delay in this process, I've seen cases of PTSD. I used to be part of the NFL brain injury program, was a treating physician for numerous athletes who suffered from what we now know as CTE. And in this regard, the medical cannabis is becoming in the forefront with respect to its clinical efficacy and the outcomes which give us the necessary re-entry into society, which is part of my specialty as a physical medicine specialist, to see patients clinically improve so they can become functional. And of course, our goal as physicians is to protect the public. So by way of introduction to the existing board, and I thank you for the opportunity for this discussion, is that we look and research in the domains that exist with respect to all the properties that exist with the cannabis plant. It looks more and more we're seeing more elucidating components of the plant. Again, there are 400. Maybe 2 years ago we thought there were maybe 60, but that's evolved into an entire cascade of what I call, it used to be a periodic table of elements in chemistry. Well, that didn't consist of 400 different cannabinoids in that sector. Henceforth, the physicians who are now introduced to this, what I would consider a medical renaissance of sort, okay, we're now learning a little bit more about the science and understanding that science, and try to get rid of some of the dogma and some of the stigma associated with medical cannabis. So without further discussion, I thank you for the opportunity for this discussion, and would entertain any questions at this time.